Good afternoon. We are here for the work session agenda of the Natrona County Commissioners. It's Tuesday, August 1st, 2024, 1:33 p.m. Our first appointment is with Visit Casper, Shelby Grouse, Kate O'Neill, Wayne Stewart. The purpose is proud to host the best and the 2025 NJCAA tournament. Come on up. Welcome.
Maybe try that again.
Hello, hello.
Hello. Okay.
Hello.
There we go. Should I just use this one?
All right, we're about out of time. Thank you very much. No, sorry about the tech issues.
That's okay. Thank you, Mr. Chairman and fellow county commissioners. I'd just like to introduce myself. I'm Kate O'Neill. I'm the sales project manager at Visit Casper. This is Wayne Stewart. He is director of marketing at Visit Casper. Today we're here to talk to you guys about the 2025 NJCAA women's basketball tournament that's coming here. So we just kind of, to give you an overview, in 2024, the NJCAA women's basketball tournament had an economic impact in Casper of over $1 million. For 2025, we're projecting a larger number than that because our tournament is going to be a day longer. And that day that is making the tournament longer is actually an off day for all of our participants. So we are working on putting together activities that are going to get them out into the community, at our restaurants, at our museums, spending money in Natrona County, and just bumping up that $1 million to a higher number.
Let me interrupt.
Yes.
Before we go too much further, I know all of us are familiar with what NJCAA is, but maybe for those listening in, just to give them an idea and that it's new to
Yes.
count.
Yep. So the NJCAA tournament is basically women's college basketball. Last year was our first year having it in Casper. This will be our second year having it here, and our final year. They only do usually 2-year terms, and that wasn't anything we did wrong. They decided they were moving it every 2 years, no matter what, before we took it on. But to that point as well, I'd just like to say that doing this event, successfully 2 years in a row is going to ensure that we get more NJCAA tournaments in the future, and it's going to ensure that they're going to give us a second look in Casper when it comes around if we want to bid on a men's basketball tournament. If they see good numbers and a good community support system, they're going to more than likely come back to us. So basically, another part of that I'd like to bring up is not only is it bringing economic impact to us, but it's also bringing us nationwide coverage. So last year, we were picked up by ESPN, which put us in front of a lot of people across the United States in their television. A lot of the teams also came from, places that have never been to Wyoming, never experienced Casper or the way that we do things with the Western way. They've hardly even seen snow, a lot of them. So it was just a big deal that they came here and chose us in the first place, and we're hoping that we continue to grow that relationship with them. So today we're here to talk about the sponsorships that we are needing to make that happen, because really this event doesn't happen without sponsorships in the community. Last year we had some key sponsors. We also had Casper College, Whole House Family, Wyoming Sports Ranch, and so far for 2025 we've secured the City of Casper and Casper College. We're here today to speak with you guys about that, and we also have several meetings scheduled in the next several weeks and months with potential other sponsors. I'm going to turn it over to Wayne now, who's going to go over exactly what we're asking for and what that includes for you guys.
See if this cord's long enough for me. Switch spots.
Yes.
Yep. Play some musical chairs here. No worries. Firstly, thank you for your question, Mr. Chairman. Just to add to Kate's answer, NJCAA stands for National Junior Collegiate Athletic Association. And so that tournament does include Casper College. Fingers crossed that they qualify again this year. But they did qualify last year, and that turnout from the community was exceptional. And just to speak on behalf of NJCAA and their team, they said it was one of the best turnouts for that tournament that they've ever seen. So just wanted to call that out. And additionally add to what Kate had mentioned about our coverage on ESPN3, to reach those markets in that type of way would cost, just from a marketing perspective, upwards of hundreds of thousands of dollars. So it's a great way for us to get exposure to that many new markets on that type of platform. But in regards to the sponsorship, we are seeking a similar sponsorship to what you offered last year, which is $10,000. And what you get from that sponsorship, again, is going to be very similar to what we offered last year. So the banner and on-site visibility offerings, the opportunity to have a vendor booth throughout the duration of the tournament at the Ford Wyoming Center, tournament passes, logo inclusion in all promotional materials and the marketing that we do on behalf of the event. On the sheet that we've provided, we've also added fun halftime opportunities, which is something that we still have to flesh out, but we're hoping to offer some additional marketing opportunities and exposure for our sponsors throughout the half times of the games during the tournament. And with that, I would like to turn it over to any questions.
Any questions for Wayne or Kate? Is it Kate?
Yes.
Just one quick one. Can you get Caitlin Clark here?
That would be fantastic.
That'd be cool, wouldn't it?
Yes. I'll see what I can do about that.
All right.
So this is just the NJCAA side. Is that correct? And we're going to talk about Proud to Host the Best in a minute.
That is correct, Mr.
All right.
Chairman.
And what did the city of Casper commit to?
We will follow up with you on that. I have it in my email. Their offering is a little bit different from last year. They structured it a little bit different with, I guess, ticket sales and the revenue that comes in from that. But I believe it's of similar offering from what they did last year. It's just, it's a little bit different, but I will follow up with you on that.
Yeah, if you'll let us know after the meeting, that's fine.
Absolutely.
Commissioner North, did you have a question?
So what are your breakdown as far as your sponsorship, your banners? How much, I know how much we paid last year, but what are the different levels? Sorry, musical chairs.
Just to clarify, are you asking if we have different levels of sponsorships other than the $10,000 amount?
Yes.
So we weren't doing that this year just simply because last year when we structured it, we did two different sponsorship packages. One of them was a nonprofit type sponsorship package and the other one was for other companies and businesses who wanted to participate. So this year we cut out the nonprofit because last year it wasn't as successful as we wanted it to be, not a lot of participants. So this year we were just going with the $10,000 sponsorship. But of course we'd be happy to take any amount to go towards this because we believe it's a great event that's going to only make positive impacts in Natrona County.
Okay, because I know last year, since that was the first year we did it, that's what we stepped up to, hoping to bring in more sponsors
Right.
and hoping to get the community more involved. And now that you have a year behind you, we're hoping that the public, private sector would step up a little more.
Yeah,
So that's the only reason why I'm asking that. So.
of course.
Mr. Chairman,
Commissioner North.
just out of curiosity, when is the tournament supposed to happen?
I have the actual days I can tell you. So it's going to be March 24th through April 1st.
Other questions? Well, I think this has been a good thing for our community. I think it'll be a good thing for our community. Where are they going next? You know?
Oh. Lake Charles. Lake Charles, Louisiana.
Okay, little different in March from here, but
Yes.
okay, great. Anything else? Well, Commissioner North did bring up that we had made this commitment last year, hoping to set a good example. You know, I don't think in my mind it precludes us from doing it again this year, but hopefully you'll get some additional sponsors who can really knock it out of the park. So thank you.
Yes, thank you so much.
Thank you.
Michelle, you wanna switch? Or I guess you-
I think I chose the correct seat for this without having any mic issues, but I really want to say thank you for having me, Mr. Chairman and fellow commissioners, and for allowing me this opportunity to speak with you today. For introductions, my name is Shelby Kraus and I'm with Visit Casper. I also am here to represent Proud to Host the Best, which you may have heard of in the past, but just to clarify, we're a committee of individuals that work to keep the state tournaments here in Casper. Two primary points that I want to address with you today would be to thank you for your support and generosity for the Proud to Host the Best and state tournaments, and also to speak with you about what is on the horizon for Proud to Host the Best and the events themselves. So starting off, I really wanted to reiterate that and thank you for your support of Proud to Host the Best and for your sponsorship commitment. Your 2022 through 2026 agreement with Proud to Host the Best has made a significant impact, not only to the students of Natrona County, but also the economic generation in our community. On the sheet in front of you, which I'm not sure if you did receive this, it's a little bit of a handout that I sent, are the most recent economic impact numbers regarding the 8 state tournaments that are held here in Casper. These tournaments generate $24 million annually. They affect businesses ranging from our transportation to shopping and retail stores, lodging and hotels, as well as restaurants. And again, I wanted to follow up and thank you for your commitment and sponsorship for Proud to Host the Best and these 8 state tournaments. As I switch gears, I want to next talk to you about what's on the horizon for these events, as well as Proud to Host the Best. In February, we'll be entering another bid cycle for another 4 years to bring these tournaments to Casper. And this is with the Wyoming High School Activities Association. So I would love to discuss with you what another partnership and commitment could look like for the upcoming years in regards to ensuring that these state tournaments stay here in Natrona County. At this time, I would like to open up for any questions that you may have for me.
What was our commitment last time?
$25,000 annually.
Annually. And what time of year was that typically paid? The beginning of the fiscal year?
Beginning of October,
Beginning of
October 1st.
What is, how long have we had, the tournaments? Has it been, it seems like it's been quite some time.
It has been quite some time. I don't have that exact number, but I can certainly get that to you of how long Casper's held these tournaments.
What do you think it would do, I mean, if we didn't have these tournaments?
Definitely. I think there's a range of effects it would have. For starters, on Natrona County, the economic impact of it, having all of these state tournaments come here. I think when you think about a hotel revenue perspective, our hotels are completely full. That means families, students participating in Natrona County, spending their dollars here, as well as being a central hub and just keeping Casper in the forefront of minds of people around the state and what we have to offer.
And
And
what
then-
is, through a given calendar year, can you run, I guess, the basketball tournament in February? Or how do these hit the calendar, these different tournaments?
Definitely. So that is structured by the Wyoming High School Activities Association. And I know that there's definitely a method to their madness, for lack of better terms, but I believe it's just the way that the sports are set up and structured, as well as schedules go. If you would like me to elaborate more, I guess I don't know if that answered your question.
Well, it looks like on your flyer that we've got marching band, volleyball, state spirit, wrestling, basketball, 1A, 2A, 3A, 4A, art symposium, and track and field. I assume that the effort during February, when the bid is coming due, would be for all of those?
Yes, so we are bidding for them all collectively, but we will also bid for them all individually. So that means we could either win them all or we could win a few of them. It just depends on what WASHA decides, and there will be other communities that are bidding against us to bring a state event to their community.
For Madam Clerk, or I know you were engaged with another matter just briefly there. Hey, do you know how long we have been a sponsor? Has it been more than 4 years on Proud to Host the
I
Best?
think Wayne might be able to
Oh,
elaborate
yeah.
more than me.
So thank you again for your questions, Mr. Chairman. I do know that we win, obviously, for bid every 4 years for these events. And the last time we went up for bid was 2020. And at that point, you guys were sponsoring. So I know it was, at the very least, as early as 2016.
Okay. So 8 years. Are you looking for $25,000 a year from the commission, or does that remain to be seen what your request is?
Definitely. So to follow up with your question, and thank you, would be that we do have that agreement through 2026, but having your partnership from 2026 through 2030 would be, I guess, what I'm requesting or asking, and seeing if you'd be able to partner with us on that.
So you would want a commitment from us before submitting your bid in February, is that right?
Correct.
So that you can plan, even though we still have, a year or so left.
Absolutely.
Okay.
Nope, that's exactly correct.
Commissioner North, did you have a question?
I was just gonna ask how much the other municipalities were, if they were participating.
Definitely. So current sponsorship levels, Visit Casper is at 50,000. The Joint Powers Board is also at 50,000. And I believe the city is also at 50,000.
And if I could just quickly follow up to your question earlier, Mr. Chairman, in regards to what it would look like if these events were not here in Natrona County. Shelby can correct me if I'm mistaken, but the majority of these events fall within February, March, April timeframe, which we do consider at Visit Casper our lag months. Those are the months where we see obviously the fall in hotel pickup and spending, visitor spending specifically. So these events significantly help fill that lag and keep traffic flowing to our hotels, our restaurants, and downtown retailers.
Other questions? What percentage, so Visit Casper, Economic Power, Joint Powers Board, City of Casper, Natrona County, what percentage is public versus private in terms of your sponsorships? Or approximately?
Let me do some math in my head really fast, but I would say that around 100,000 would be private. Right now, our budget is $277,000, and the goal would be to extend that to 300,000.
Commissioner Mill?
So just to get it straight in my head, you're not asking us for an increase in our sponsorship, or are you?
No, it's just another commitment for another 4 years.
Well, but now I need clarification. Are you asking for us to make a commitment now, or once you kind of put things a little bit more together, like maybe late this year or January of next year?
Definitely. As it sits right now, we do have that MOU agreement. So really, it's just reiterating that agreement and bringing that up attention again for this next year, and that ends in June of 2026. But then it would be, again, asking you and just putting it on your radar for that next 4 years. And I guess to your point would be a commitment, so we can go ahead and move forward with that bid, just knowing what our sponsorship dollar amount looks like.
I personally feel like we should support both of these efforts. And I personally feel like our level of support should be, pretty close to what it is at present. I think that the other commissioners can weigh in on kind of how they're feeling. We can't make a decision right now. And in fact, we might have a little bit of back and forth with you just to have a little bit of clarity on what your needs are and what we feel our ability is. But I personally would like to see us be able to commit. Commissioner Laird?
I am totally in support of your requests. I think it's a good thing for the community.
Commissioner Mellon?
Jumping back to the NJC. So after this one goes through, then it's heading somewhere else? Is that my,
That is correct.
Lake Trail.
okay. So I don't have a problem with either one of them. I wouldn't mind seeing maybe the NJC stay the same, but I wouldn't actually be opposed to maybe going 30 for the state games.
That's
Instead of
kind of what I'm
25.
feeling too, is the NJCA could be the same, but we can bump the other one, or should bump the other one a little bit, whether it's $5,000 or $10,000, I think is kind of what my
know.
gut's telling me.
I know Campbell wants it.
Mhm.
Let's keep it here.
Let us, I think what we'll do is we'll put together maybe put together a letter that makes it official, and have the commission consider that at our next meeting. Maybe 2 letters, one for each of these, since you might attach them to something else in your marketing efforts. But I think we can do that, and the commission can consider voting on it on the 15th.
Wonderful. Thank you, Mr. Chairman and fellow commissioners, for having us and for this opportunity as well. And I will follow up with the questions that you asked, just to make sure that you have that information.
Good. Okay, well, thanks so much. We appreciate you guys.
Mr. Chairman,
Yeah, Commissioner Laird.
if you guys can get Caitlin Clark here, I'll buy her a round-trip airplane ticket. Let her know that I've said that, okay? Thanks.
Perfect selling point for us.
She might have a jet by now. Okay. I would just like to say that we did at our department head meeting this morning discuss some, that we're going to be getting some, I think, new tech in this room and maybe the other room in the near future. So hopefully we won't have battery issues every time. Our next appointment is with Anna Kinder, Natrona County Health Department Director, our coroner Jim Whips, and Ashley Bright, Jim Krauser, Sean Moore, and Jaela Sutherland, council member. What a distinguished group of folks. Please come on down and we'll make what room we have. Excellent. So my thought was, first of all, welcome. I think if you all could either introduce yourselves or maybe Anna, could introduce you, but tell us what groups you represent. The purpose for you being here today is we had on our calendar that we would have a 6-month update from the Collective Health Trust and from Banner. We were advised that we no longer have the contractual, they're not required to come every 6 months, so we'll be seeing them in the near future. So we had a gap, but I tell you that we've been talking to our coroner and we've been talking with Anna for certainly this calendar year and probably goes back before that. And when we're talking to the coroner, it's usually about, tragedies and death and we see youth violence, we see overdoses, we see just a lot of people struggling. And I know Anna has spent a lot of time this year working on mental health, but I felt like we just are out of Suicide Prevention Awareness Month, and we have Sean Moore in front of us, and I'll say, sir, thank you for your service, and thank you, your service continues. And I was at the Wheeler Hall at Casper College a couple weeks ago when you were there, and it's just, I'm super grateful that you're here in particular. And anyway, so that's setting the table for just a second. And now if you'd introduce yourselves, we'll start chatting.
Obviously, I'm Anna Kinder from the Health Department.
Ashley Bright, Boys and Girls Clubs of Central Wyoming.
Sean Moore, Governor's Challenge, Another Day Suicide Mortality. Jim Crowder, CEO of Central Wyoming County.
Jaela Sutherland, I'm on the city council here representing the commissioners.
Sean, can you hand me the clicker that's right by your hat? Thank you very much. So otherwise, we'll get started. All right. So thank you very much for your time, Mr. Chairman and Commissioners. I'm fortunate enough to have these individuals join me today. Some of them tell you that they really didn't know what they were getting into, perhaps. Yep. So they will tell you that they didn't know what they were getting into, but there is a reason why they're here. So we want to give you a mental health snapshot of our community. It may not be the most pleasant thing that we talk about today as we move forward, but I had to like tell you this because, where is it at? Does it not work? This could be interesting. There. Obviously, I need to tell you that the building is on budget and on time. So that is what I'm going to say about that. These are current renderings of what the building will look like. We are under strategic planning at the health department, recognizing that we're coming out of COVID and perhaps we need to look at what's going on in the community now more than maybe what we did before COVID. So we've been spending a lot of time looking at our mission and our vision. We want our community to thrive and provide excellent care and access to health resources. And we're going to focus on empowerment of our community as well as quality and respect. Some of the newer programs that we've already added is we'll be doing testing for the age-required lead testing of our children. We do have where we're starting to put that on a GSI map in order to make sure that we're not seeing any trends or any particular areas of the community that have elevated lead. We also are working with problematic gambling, which is through you all, a contract that we have. I work with Central Wyoming Counseling Center where they hold groups and we support that activity. And we've developed a team with one of my staff members and theirs that will meet together to talk about kind of things or trends that they may see in the group activities. And then we'll take that into industry. So we'll talk to the organizations that have gambling in their facilities. And we also now are required by our county health officer to all be trained and carry Narcan. Workforce continues to be an area that we challenge with and have struggles, funding across agencies. We are short some staff, but one thing that is in the process is we're working with NextGen, which is a government initiative to bring together, for example, the college and industry to build a strong workforce. What are the limitations and how can we work to make things move forward? One fortunate thing that we do have on our plate right now is the Community Health Needs Assessment, which is done. It's a requirement for Banner to do, as well as for us if we're going to pursue accreditation. It's also part of Community Action Partnerships work that they have to do for federal funding, which will be a very intensive data collection and strategy development. It's also what the Collective Health Trust utilizes for their goals and objectives. So this is a very collaborative approach with Banner, the Health Department, CAP, and the Trust. I don't know that it's always been this collaborative. It has had where each of us might have been doing a component of our own, but we're coming together to do it to get a more informed presentation. So we're at an intersection in our community where we're recognizing that mental health, suicide, and violence are at a high, and we have concerns. We know that public health addresses crises, and right now behavioral health is that. And we're looking at the social determinants of health to help guide some of that information. So you may wonder what those are, and those are the environments where people are born, live, learn, work, play, worship, and age that affects their wide range of health, functioning, and quality of life outcomes and risks. Those circumstances where a person is born into, grow up, live, and work are how they deal with illness. So we want those non-medical factors like the neighborhood and built environment, social and community context, education, and economic stability to impact. It all impacts the health and longevity of our citizens. We look at the risk factors that impact Natrona County. It's really not unique to our county. It is seen across the United States, but we definitely have access to substances. We have easy access to lethal means, low access to care and services, community connectedness, isolated from each other, bullying, finance, work stress, social isolation, minimal support, trauma, abuse, behavioral health, economic security, trauma, violence, all of those things that we've talked about before, all of those contribute to our mental health crises. And there's no specific order to those. Duke University actually has a data dashboard that they collect on readily available information that they can see what the Medicaid expansion is, which we know we don't have, what the opioid-related hospitalizations are, distance to the nearest MAT, medication-assisted treatment, provider is, adults reporting binge or heavy drinking. So you can see healthcare is a high need in our community with the mental health and substance use disorder treatment, counseling, addiction, professionals, recovery support systems. Then we get into more of the prevention service, harm reduction, and recovery community center. I had the good fortune to be part of the Wyoming Business Council's project that brought us in to address problems at a community-wide level. And we developed looking at mental health, and this is the fishbone diagram that talks about how like the family dynamics has changed, causing stressors, the lack of support systems. Our society is more divided than ever. Silos exist between resources and those that are needed to meet the needs of the community. And mental health is not a priority, if at all, mostly stigmatized. When we talk about the access and awareness challenges, what we're finding, and I did a survey that I took to our community partners where I sent it to 106 individuals and got 71 respondents to come back on that. What they talk about is while we all work together and know the services that we provide, there are certain things that we don't know about each other. It's very hard to know like the individual programs that Jim at Central Wyoming Counseling Center may have. Yesterday, I talked to Ashley and knowing about all the different stuff they have. We all work well together, but we may not know all the resources that are available, and knowing how to gather all of that and work with that is very challenging. We also know that parental disengagement is a high area of concern. Imagine, if you will, that you're struggling with your own illnesses, mental or physical, and you have a child that you're responsible for. How are they going to get their needs met? We know that emotional distance, the detachment, if the mom and the baby do not attach at by a certain age, the impacts that will have, lack of supervision. We know parents are working multiple jobs or working at night or different things that will impact the person's development. We have little to no rules, lack of interest, and lack of involvement. Funding in mental health, there is limited funding. We recognize that. This is not an area the health department has done in the past, but is definitely a concern that we have. We are charged, our responsibility is to look at the population as a whole and what impacts our population and what kinds of trends that we see or areas that we could make a difference. And with that, we are looking to see how we can help improve the overall arching thing, which I hope we'll be talking about here in just a moment. The Board of Health has also dedicated some funding because they recognize how important this need is. We also know that there's a lack of service continuity. So when a person is discharged from a particular treatment facility, recovery, there may not be something on the other side to help pick them up from that point to give them resources or support that they may need. So a lot of times a person will get discharged from a facility and they may not have anything on the outside. We are working with that with some of our justice-involved individuals, but in reality, there are some places where service continuity does not exist in our community. So with that, I'm going to turn it over to Jim to kind of fill in some gaps and pieces of what he's seen. He's been lucky enough to have joined us approximately a year ago. Okay, so you have to take a mic.
All right. Is that good? Okay. Yeah, I think what I've seen in the past year from the lens of being a behavioral health provider and in the community is consistent with what Anna's presented, and also seen a lot of really strong partnerships that are building or becoming more mature across some of these issues. So collaboration has been really inspiring. Got a lot of work to do still, but a lot of agencies are recognizing that to address these things, and especially in rural communities, we've got to have networks that create a continuum. You can't just build more buildings and think if you put up more treatment centers, people are going to go into them. But it's to get out with public health, behavioral health, blending with them, and going where people are that are having challenges, and being able to meet them in ways that make it less impediments to get access to services. So mobile clinics, providing services where people already are, work sites, school districts, those kinds of things. That way there's less barriers, less transportation challenges, especially when you look at social determinants. Folks that have to worry about how much they spend on gasoline have to make a decision. Am I going to drive my child to counseling, or am I going to get to work for the rest of the week? How do we address some of those things so that we have access, available to people of all areas in the community? And I think there's a lot of great partnerships looking for unlikely partners. I'll say it's impressive to have relocated here, at how involved both our law enforcement and first responders are in looking for solutions in addressing mental health issues. Many other communities are much farther behind Natrona County in some of those solutions and willingness. And that's I think a huge piece that Anna, pointed to. I think our school district is very eager to find ways to both obviously adhere to parental preferences and rights, and also look at how do we create environments that are safe and supportive for youth to be able to talk openly about the issues around mental health and have solutions that are available to them that are palatable. I think
Can you talk about your
Yes, we've since July, with behavioral health redesign, at a state level, they allowed more local decision making for community behavioral health centers, and so we were able to we increased our crisis beds by 400% in July, and our census has maintained at 400% what it had been, or 300 ish. So we've treated over 100 individuals for opioid or alcohol withdrawal or detox that didn't have to go into a hospital. Just that alone is a huge, significant move for us. Our partnerships, though, with the hospital has been critical, because sometimes people are too ill to remain in our lower, level facility. So having, partnerships with, we have a mobile crisis team that has started in July to be able to transport people to the hospital without having to call an ambulance and bill the county for that, or that individual that may not have means to cover it. If our medical team determined they were safe and they're already a client, we'd take them up. And so that partnership is both started and maturing. And I think, when we look at analysis on cost and expense to the city and the county, there's thousands of dollars on a daily basis that are saved in each case when somebody is able to be treated, at a lower level of care and outside of a hospital. We're grateful for some of that flexibility that Department of Health has allowed community behavioral health centers to have, to start making local decisions about what are the needs in our county, as opposed to having a state mandate of size of beds and those kind of things.
And we'll have time for questions and discussions at the end. There's a lot of information to get through, so we're trying to be aware of that and also be able to get you to leave onto the next topic within reason. The next thing that I wanted to talk to you about is I have spent time with Casper College and learned about their CARE program, where they do have the ability, an instructor or different parts of the community at the college can report a student that they have concerns about. This is a snapshot from one semester in previous years of what their needs could be, from basic needs concerning behavior, and you see mental health is by far outside of that. The referrals that they get are quite staggering. They've talked about how in days past, students used to be very interactive with each other, going to the union, doing different things like that. But now some of that has slowed. In class, there's not as much discussion, or we're going to all these online systems. So that connectedness and relationship is not as easy as it once was. We also have the Natrona Council for Safety and Justice, and I would invite any of you to attend that meeting if you're ever able to do that. I know you're all very busy, but it started in 2021. The hospital called together a large group of people. We had, I don't even know how many people were there, representing all walks, from fire, police, different municipalities, health, just everything that you could think of come together, because what they were recognizing is we were overloading the hospital with emergency room incidences that weren't necessarily in the right place. Also, what are we doing when people are released from jail? Do they have something on the other side to help them be more successful so that we don't have the reentry? So we came together, it's been working since 2021, and they've mapped the intersections of behavioral health and criminal justice systems to identify the resources and gaps. It continues to work to this day, from everything from behavioral health crisis to transportation, housing, just a whole plethora of things that we recognize in the community that needs to be addressed. It is by far the largest group of bringing people together that I think I'm involved in across the board with as many different meetings that we have. There's a lot of collaboration, working together to make things possible. And I think the biggest successes that we've had is those involved in the jail or those with lived experience. You may have heard about the downtown outreach, where a variety of the service providers will go to where a lot of the people who are unstably housed and provide services. We provide testing there. It's not in our deliverables, it's not in our grant funding, but it's something that we believe is public health. We go and we provide whatever resources. We've provided cancer resource connections. We have referred them to other agencies. We've actually found moms who are pregnant who are not connected to any kind of maternal child health services. So it has been very successful for us, as well as I know it has been for others. We also have Kind Grounds. That is a place, especially in the winter, where people who are unstably housed can go to, that have resources. There's social services that meet them there. There's meals there, and it's a warm place to go when, you know, we all know what the weather can be in Casper. And we have the RISE program and Thrive Together initiative. And I think the successes that we've had with all of those have really, we actually have people who are parole or different entities that participate in what was once called SIM is now the Natrona Collective, or Natrona Council for Safety and Justice. In my mind, it will always be SIM, so I struggle with it. So when we talk about prevention or about public health, I think I've talked to you about the upstream, downstream, midstream kind of thing. There was the parable goes that if where they saw all these children coming down in the river, someone went upstream on the river to find out why all the kids were falling in the river. So that was the upstream approach of what needed to be done to fix. So that's kind of the parable of how we look at prevention. So we are looking to really go upstream. That's where we're going to have the community impact, and that's what we're going to talk to you about today, and the ask that we have to really look and address at those policies and procedures, and I'll talk more about that in a minute. When we're in depths of crisis, we actually deal with more of the midstream or downstream. You can see that the response often is downstream of what we do. So our request or our desire is to move more upstream to kind of stop some of the things that are happening that impact further down overall. So that prevention kind of component. Those are the policies and procedures and prevention. And unfortunately, prevention is usually seen with a small p. It's not the critical, because we're always providing the treatment rather than the prevention of whatever causes you to have the disease process. So one of those examples, which we'll talk about here in just a moment, is the peace in our cities. Perhaps cell phone usage is an area that we talk to different people. I'll show here in a moment what Converse County School District is doing. I did talk with the school district this morning, and there are some schools that do put the cell phones away in the locker during the day. It just depends on the school specifically. But possibly these are some areas that could be upstream that we could address that would help the overall problem. We also have Credible Mind, which I've talked to you before about, which is an online platform that's available to anyone, anywhere, anytime for mental well-being resources. We're really trying to get those individuals that are under the waterline, if you're looking at an iceberg, rather than those above. Those that are above the water, those are the ones that are accessing services, asking for help, connected to those things. If we can make a difference, like keeping a person from going over that line, Credible Mind is a piece of that puzzle. And I think the mobile crisis unit, we spent a lot of time talking about what is the one thing that would prevent this person from going into a full-on crisis. So Credible Mind is a resource that we have. We partnered with CAP to purchase it the first year. We're providing it this year. We utilize it for our employee assistant program, but it's free. You can access a ton of information, and it's all evidence-based, which really is the key to having what we need to provided, and it's proven and solid. So with that, I'm going to turn it over to Coroner Whips, who will talk to you about suicide a little bit more directly.
Maybe. There you go. Between us, I mean, our conversations in the past usually go to this anyway, so I'm going to kind of let you know where we're at and maybe some of the things that we're doing with this. So in the last 2 months, since I talked to you last, we've had 9 suicides. And that brings us in the county to a total of 24 for the year, which we still have 3 months of the year to go. And if the last 2 months are any indication, we'll set a record that was worse than the one we set in 2021 with 33 total for the year. There's been a lot of push and direction and demands from the community and the parents that I speak to, centered around youth this year. And obviously because of the cluster of bad events that we've had, from homicides to suicides. And I got to tell you that the community as a whole this year has really started to jump through too, where in the past that you really haven't seen that. And I think that a lot of it's because of the awareness to the problem, where people a lot of times may hear about the one here, the one there, this or that. You know, I think we're getting the word out that this is a lot bigger problem than most people think. There's a lot that makes up this youth-based stuff that, as I told the school board, you know, when you're looking at the base of the iceberg versus what you just see at the top, which is what Anna just referred to, so many things that are happening within our youth population that, quite frankly, are just getting out of hand. And it all leads to a bad end result. As an example, we've had in 2023 through August, we had 119 Title 25 381 holds with our youth. This year already through August, we're at 127. That's increasing. Everything that we see is those things that make up the base are increasing. People think of suicide and they automatically tie that to mental health. And there's a narrative that has to be changed, because suicide is not a mental health condition. Suicide is a social condition made up of risk factors, which, going back to the slide that Anna had up there of all the risk factors in the social determinants of health, that right there for our county, for our community, is what's making up the suicide rate. It's all those things coming together and piling on someone to take them down that dark path to that. And that's what we see increasing throughout the community, is when you look from the outside in, are those risk factors becoming worse and more prevalent, and individuals experiencing more of those risk factors as opposed to maybe just one or two. They've got a whole bunch of them going on. But again, we have to take and separate the stigma of suicide being a mental health condition, that someone's crazy. Mental health may be a contributing factor in a lot of cases, but it's those social issues that are making up the problem and getting us to this point. and what we have to work on upstream if we plan in the long term to have any prevention and reduction in these numbers in our county. Let's see,
Mr.
what
Chairman,
else?
I just need a clarification. What do you mean by these other factors that would cause? Yes, yes. What do you mean by that?
If Anna could actually go back to that one slide, it kind of explains it really well. Right here. So, nope, this one right here, the risk factors impacting Natrona County. When you take a look at suicide that happens in our county, these always show up as the base that leads people to kill themselves. Very seldom do we have just an impulsive, off-the-wall suicide. It's always made up of a contingency of what you see right here that built up, that caused people to go into crisis. And again, if we're going to play the long game and reduce our numbers, not only in suicide, but in overdose deaths, in substance abuse deaths, and substance abuse, I mean specifically alcohol abuse deaths, which is through the roof this year, substance abuse deaths, which are through the roof this year, suicides, which are through the roof. All of those are coming into here. And that's the upstream stuff I think that Anna's talking about, that as a community, as community leaders, we need to put focus on in the prevention efforts. Good.
Thank you very much for that. I had the good fortune of meeting Sean Moore at an event, which I know two of you were at, and I'd like you to tell your side of the story, if you would.
I'm Sean Moore. In August of 2019, it's a day that I'll never forget because I live with a constant reminder. I survived a self-inflicted gunshot wound to the head, provoked by a thunderstorm. That night, I thought someone was outside with a gun. So I went in my nightstand. Thankfully, no one was outside. Because had there been someone outside, it'd be a different conversation that we'd be having today. In theory, the bullet went under my chin and exited out my nose. Being scared is what saved my life, because I moved the gun just right to where it could exit out of my nose. And I know you guys had a lot of questions about some of the risk factors, so if you don't mind, I'd like to share some of mine that helped lead up to my suicide attempt. After I got out in January of 2018 from active duty in the Marine Corps, I started having these little random thoughts of like, hey, you're not worth it, or pretty much kind of like flashbacks from my childhood to current. That it would flip the narrative in the script to where these events happened because of you, whether it's true or not. And so I went and started trying to ask for help, and this was all in the Rapid City, Sturgis, South Dakota area. And a lot of the times I'd go into the Black Hills VA system and I'd tell them I wanted to see a counselor. They'd tell me no, and they'd tell me that I walked in there and I can walk out. So I was pouring gasoline on an open flame fire. So I found a construction job. And so I was working about 100 hours a week because I couldn't sleep. So they said as much overtime as you wanted. It worked good till it didn't. And ultimately, that's what helped lead to my cause, is the fact that I didn't have the community support And trying to ask for help, I wasn't getting it. And just, so that's why I've started focusing on sharing my story, is because it's going to take all of us in order to help even make a little bit of progress. And just ultimately, the biggest thing that I've noticed that amongst the military is that oftentimes we're grouped as you're having these thoughts because you went to war. You're having these thoughts because you had to be broken down and built back up. Instead of like what everyone's been saying, instead of addressing the overall problem.
Mr. Chairman, would you take any questions now? Before I, oh, okay. I just wanted to kind of stay with it when I thought I was tuned into it.
Yeah, we'll come back. All right, so one other thing, I know at the last commissioner large meeting that you might have had rather large attendance at recently, might have a little memory of that. You talked about 988 for the two of you that were at the Prosper event at the college, the importance of 988. If you've never called it, I would call it just to say you are curious of what the process is, what it looks like, how it goes. They're very willing to do that. They did that in a training that we were at. And it's also for those if you have concerns about someone else. So it's not just for the person who is looking or seeking help. So you can text it, you can call it, you can chat it, all of those different things where if you're having struggle or a loved one is, and it's universal 24/7, thoughts of suicide, mental health or substance use crises, emotional distress. Do you have anything that you would like to add because it's out of your facility that 988 is? Okay.
Really well with the slide, and I think the shift is it's not only for someone who's actively thinking about taking their life or killing themselves, it's also for folks who are in other kinds of crises or needing some support and be able to have a group that can answer for you. It is local. We cover 12 hours a day of the calls, and then another group in Wyoming covers the other 12 instead of geographically. So you will, unless there's too much call volume, it does default to a national call center. But majority of the time, it's someone in Wyoming. We do work with 211 to have resources available to help walk people through and helping them get connected to services maybe within the next day. There's also callbacks that you can ask for. So we always do follow-up calls after someone's called. So we'll call the next day to check in on them. How are you doing? You reached out. It is a highly effective way to address some of the issues around access and around mental health and in the community. And we recognize since it went to talk and text in the last 2 months, we've had utilization rise dramatically, especially within the younger age ranges. And we recognize that's just a lot of that is demographically, that's how they communicate more. So expansion's been really, some degree it's been great that it's utilized. We certainly wanted to, it'd be great if it was out of business, but we need it. And so we're putting it in there for the opportunity to connect. But reducing that threshold that people think, I don't have to wait till I'm thinking of killing myself to call. We want you to call if you're getting bullied, if you're concerned, if you're having thoughts about I'm not worth it. And what's the point in some of your story? Thank you for sharing that. There's times we can intervene with folks that can save a life that don't involve therapy or necessarily an institutionalization.
Okay, thank you. And I think that we're starting to see it. I don't know if it's on the sheriff cars. It is on the city council or the city police, the sheriffs. They have 988 stickers on the back of their vehicles. We have posters, there's billboards, all kinds of stuff. They're really trying to get the word out. But it amazes me how many people don't know what that is. When I was in that project with the Wyoming Business Council, I was in with 2 people from a municipality, a real estate agent, and a person from business. They did not know what 988 was. And that was very hard and very eye-opening for me to recognize that while we talk about it, we know about it, how many people don't or have never heard of it before. So there's also a new program. It's part of the governor's initiative. It's called Prosper, which is proactive reduction of suicides in populations via evidence-based research. Dr. Kent Corso is going through the state of Wyoming. It's a 3-year project. They're providing training. So the first training that Natrona County went to was 2 days in person for first responders that talked about the training. And then since then, they've had a community event talking about it, which is where I met Sean. All really trying to standardize that language that we talk about. It's no more, it gives you the tools that you need to actually have a real conversation with someone. Basically, there is no sugarcoating it, right? It's like, so I understand that you plan to kill yourself, and you work through the process of getting them connected to whatever help you need. It is hope that we can push this out throughout the entire community, that we're all using the same language. And other counties in the state have actually worked to get a further larger involvement with Prosper in their community. For example, Teton is doing more. And then we also have to think about suicide can be seen as an internal violence where you harm yourself, where we see violence on the outside as well. So Prosper is really gaining momentum. I was quite taken back with it, and I think the ones of you that participated in that training would agree. And if you have the opportunity, there are online trainings coming up as well as another day. They're also working with looking at policy, particularly around the Good Samaritan Law and Title 25. What do we need to do to make sure that we're covered if we're doing all of these different tactics? So that will be coming in the spring, and some of that information is in the process of being developed now. So when we talk about violence and bullying, it's exacerbated by social media. It's a critical issue. We see it among our youth, but it is also all through adult. We need to get those prevention efforts that build relationships and reduce the bullying through proactive engagement. One of those areas is the restriction of cellular phone use. So Commerce County Middle School, that's their policy that they utilize. We're aware of Facebook fight clubs that exist where they're actually just filming each other in a fight, and it is one of those things that not the common individual would find. Snapchat is also really good for these kinds of areas. Wyoming has one of the highest rates of bullying victimization among children in younger age groups. So if you go back to the risk factors and the social isolation, the connectedness, all of those things all contribute to this again. We're all very familiar with the keyboard warriors. We see it when we do something in the news, everybody definitely has something to say. So if I say the sky is blue, odds are somebody's going to come at it and say something different, and it probably isn't going to be nice. So with that, I'm going to turn it over to the Boys and Girls Club, which is one partner that actually has some programming that's in place.
Sure, thank you. Thank you, commissioners, for holding this and allowing us to come and speak. There are 5 areas that I'm planning to go through. I'll touch on club programs and stories. There's a pilot program that we're working with DFS called Care Portal. It's a technology-based program that identifies needs. The caseworkers plug in the needs, and it's networked to champions around the community what those needs are, so that they can go to the families and meet the families right where they're at. Concrete needs, and then also we want to have mentoring and social and counseling needs. Be in. Okay, sorry. And then some next steps and some needs that we're seeing that are practical and they're action oriented. And then I wanted to talk briefly about the Montana Meth Project, and I'll tell you why. So we are becoming a trained, trauma-informed boys and girls clubs. which means our staff is now being trained for those type of behaviors in the behavioral realms that we're talking about, with from ADD to behavior defiance and those realms. So social emotional learning is happening in the Boys and Girls Clubs for those members, and our staff is being trained to deliver those programs. So we're piloting a program with DFS right now, and the program is called Care Portal, and it is a technology based in 31 states. Governor DeSantis, his wife, the first lady in Florida, she's championed this. It's in 31 states, and so what we're looking to do is network and galvanize champions in the community. So when there's a need that happens from DFS to the foster care system, caseworkers, that it's going out to champions, networking churches and other champions in the community so that those needs can be met. We are, what we'd like to do in the Boys and Girls Club is see if we can work with Central Wyoming Counseling Center, as an example, if we can have an overarching counselor that could work with our staff, our behavioral specialists, have social workers on site, that would mean a lot to our Boys and Girls Club staff to be able to handle those needs, identify risk factors, and then we could meet monthly or regularly with counselors. We're serving hundreds and hundreds of kids daily, and the right kids in the Boys and Girls Club who need our support and help. And then the Montana Meth Project really came to heart. And then there's one other thing that I want to share with you too, because I'm doing some research on how churches can get more involved in mental health in the community and mobilizing that community for support. And so, but let me talk about the Montana Meth Project. So in the mid 2000s, there was a big marketing campaign with one message: not even once. And it was invested in, and it was on billboards, and everybody had the message. And the results of not even once was massive. And if those of you that remember those graphic videos, they were intense. And I'm not saying that we would do something like that with this issue at all. But could we come collaboratively, as Mr. Whip said, with one message where it's everywhere and that we're in constant reminder, and then, could that help us all? Could we work into an ecosystem? We talked about this, where we're all not siloed in the many things that are happening. But back to that marketing, I mean, the marketing was amazing. It was very effective. And could we do that with a positive message on prevention side? And I don't know what the tagline would be, but could we invest that way? I don't know. So I've been researching how churches could galvanize together, and found a church in Littleton, Colorado, and it's powerful how they are pulling the community, because we have food distribution, we have many things that are going on in the faith-based community that are powerful. But what if we could get the church community, get our community embraced around mental health? And there were several. It was a powerful presentation. I just have a couple of little notes on it. So their factors were technology, unfettered access to information, the family structure, coping strategies modeled by these are factors contributing to mental health crisis, school academic demands, peer interactions, social isolation, consequences of sexual gender revolution, and trauma. That's what they identified. And there's workshops and things that we can do to make this aware to everybody in one message and pull people together so that we can start making an impact in this area. So those are just a few things I wanted to share.
Thank you. One interesting thing when I was talking with you yesterday that I kind of attached to and really liked a lot was what you referred to as a mental health ecosystem. And I was like, huh, that does make sense, right? When we think about the social determinants of care, that overarching, that rounded, if we, Biodome might have been a movie some of you have seen, but like we're inside that bubble. We provide the structure, the support that people need in our community of Natrona County. What are the possibilities that we could do? One thing that I thought was interesting talking to the school district today is they talked about they have a student for 14% of their time. 86% of it is out of that. So if we have the Boys and Girls Club and we have structure differently, would that make a difference in some of these individuals' lives? We all go to work approximately 8 hours a day, 5 days a week. Like outside of that, what structure, what support exists with that? So I like that conversation that we had yesterday. It really helped a lot. So we're kind of pitching something. We're building a case for what we would like to do, and had the good fortune of meeting with Councilor Sutherland last week. It was just last week, right? Talking about peace in our cities. And I know that Chairman Nicolais and you heard a presentation by her, and perhaps this could be what we might be looking for. So I'm going to turn it over to you.
Thank you. Hi, everyone. Thanks for having us. Sean, thanks for sharing your story. I'm still kind of processing it, and all of this is a lot to talk about. And I think we've all been really touched by what's happened in our community over many years, but especially this year. It's been a hard year. So I just want to acknowledge that as we try to do something about it. So I think maybe I'll just do like a quick introduction of maybe why I'm here. So first of all, obviously I'm sitting on the city council right now, but my day job is working for a foundation that focuses on global issues, but my team focuses on violence reduction worldwide. As part of that, my team partners with two other organizations, and together we co-facilitate the Peace in Our Cities Network, which is an organization. It's a network of 24 cities and 40 plus organizations all over the world who are committing themselves to reducing violence in a way that is relevant to their own setting. So not every city has the same goals. They have goals that are relevant to what they're facing. And Peace in Our Cities is a network that offers assistance to those cities in terms of meeting their objectives, and also connecting them to experts that help run the network, who use evidence to inform how to approach violence reduction in a balanced way. So I think that we all are in agreement that we have major issues here in the county. Our people are struggling. Our youth in particular are struggling. We see the challenge of homelessness on our streets, substance abuse, and as Coroner Whips was saying, obviously increased violence and suicide. But I think also it's clear that there's a lot of work that's being done right now. There's a lot of good effort, and I don't know if you were tracking everything that was just shared here, but I think I've actually been quite inspired by what I've seen and witnessed in the time that I've been on council, and in the slice of the pie that I've been able to see. I'm inspired by our community showing up, and I think that it's also clear that we want healthy people. We want our youth to be safe. We want them to feel like they belong here, that they have a future here, that they are worth our attention and our care. I think we also have really good resources in this community. I mean, this is just a handful of people who are actually showing up saying, what can I do? How can I help? And so we've got the Council for Safety and Justice. We have the Youth Mental Health Coalition. Obviously, there's the Health Trust in our schools. Community organizations that have come together, like the Blue Heart Initiative. So many groups. And what it seems to me, and what we've been discussing, is that it's not a lack of effort. It's just that we're kind of lacking an overarching strategy and a plan. And I think that that's certainly something that we can develop. I think it's pretty clear what some of our goals could be. We just haven't quite gotten organized to be able to sit down and articulate those goals and then build out a strategy to meet them. And so that's really what made me think this could be something that Peace in Our Cities would help with. Because really the network is designed to be a support system. It's not like a municipality or an organization has to pay to be a part of it. It's just a resource. And it's people who know violence reduction, who understand that there is a tiered approach to it, that there's upstream, midstream, and downstream. We use that same analogy in violence prevention. It's based off of public health. And the idea is that you focus on prevention, you interrupt it when it's happening, and then you recover and you rehabilitate when violence has occurred. And there's tons of evidence out there to support initiatives that actually have meaningful results. So what is nice, I think, about joining a network like this is that we don't have to recreate the wheel. There are cities out there who are facing these issues, who are doing the work to tackle them, and by joining, we just gain access. So I think it could just be a great support system to our community as we really navigate the approaches that we want to take. And again, really building off the resources and the groups that we have already coming together and saying, what can we do? It's just helping. We were talking about, do you have a center of gravity where everybody's working and focusing on, shared goals and finding alignment with another, or are people kind of going in different directions? And I think right now, everybody's just trying to do something, and that's amazing. There's no fault to it. It's just that I think from a governmental perspective, we can do a lot to lead and help kind of orient everyone toward common and aligned goals. So some of the cities that are part of the network are not really facing the same violence issues that we are, but many of them are. And so I think what joining could do is just help us not feel alone in the process. And I hope that what it could help us also understand is that there are ways to achieve our goals in a balanced way that looks at prevention. Prevention's so much cheaper, the outcomes are better, but also acknowledges that we do need balance. And there are times where our law enforcement is going to need to step in, but let's do it in a way that makes sense, that maximizes our resources, maximizes the people and the organizations and the systems that we have here to really meet the need. Because I think I actually, while it's hard to sit here and have these conversations, I actually feel quite optimistic that we have what we need to make a meaningful difference. So I'm just hoping that we can continue to work together to get to that point.
Thank you. So basically what we have is a lot of puzzle pieces, but we don't have that structure to know what the picture is. Everybody is doing like a component or a piece, like the number of programs that you mentioned, or the programs that are at your facility, or the prevention task force. Like, we all have different components or pieces to the puzzle, but we don't have that big picture kind of thing to put it together. So with that, what we would like to do, and I think it's a conversation that needs to be had, or at least initiated, is talking about the opioid funds that we do have. We're not here to ask for those at this time, or who knows in the future, but what needs to be done is to actually talk about it and come to some awareness. There are tons of resources that are out there. Many places are doing it, but also on the other side, they're starting to look at cities and states that aren't utilizing those funds. And I would hate for them to think that we don't need them because we can't structure them or know exactly how we want them. When we look at opioids, it fits with all of the things that we've just talked about. It contributes to the suicide rate. It is not an upper, it is a downer. So it brings everyone down, not able to deal with things. They don't have healthy strategies for them to care for themselves. It's an escape. It makes them numb. So there are tons of documents that are out here that, they may fit the description of suicides the different age groups, psychiatric conditions, etc., shared risk factors of all what we've been talking about, the mental health, substance use, disengagement, violence, suicide. They're all contributing factors. So I think it needs to start to have a conversation about what could be done. I know that there has been a process in place in the past, but I'm asking that from a public health and all of my partners' perspective, that perhaps now is the time. This isn't something that we'll get a chance to do again. It's one of those one-time kind of opportunities that, you know, do we seize the moment? It obviously needs to fit within the parameters, and I don't know what the parameters are. I think everybody continues to ask me, well, what is the ask? What will solve the problems? This problem is so large and it changes every single day that it's very hard to like make it tangible to see what it is we exactly need and want. But it's a unique opportunity, perhaps, that some of these funds could help. It would get us ahead of the addiction instead of the post part of it. Can we end the schedule with it? So potential solutions, you know, I was raised with always, you know, you can't bring forward a problem unless you have a possibility of a solution. Well, that's easier said than done. I think I've talked to you in the past of the importance of having a health navigator. I talked with Ashley about that yesterday, where, you know, the program that he referenced, the care portal, where it goes out to the community and has an ask. What if that ask can't be met, but we could sort of meet that need? So there needs to be that person that carries that through, that makes that happen. A real live person. 211 is great. I can't tell you the number of phone calls that we filled because people are looking for, I don't know where to go, I only have Medicaid, or I don't know a provider that will take me because I have this insurance. There is so much time, and if you only have just a small window of time to ask for help and you meet these barriers of, I don't take that insurance, or we can't serve you, or we're full, or whatever the case may be, that person just spent their break time trying to figure out how to ask for help, and we put up the barriers. I know that some of us have No Wrong Door, that we could reference that as well. Prosper is that a community-wide initiative that we take another step above and beyond what the governor has put into place for us. Sean is willing to talk in anywhere place. I mean, I asked him and there was no hesitation. He was like, yes, I will be there. So suicide is not the answer. Ask a survivor. Maybe that's what we go with. Pushing 988, the Boys and Girls Club, other activity-focused facilities. I know we spend a lot of time with the youth, but it's also just as much with adults. Like, I want to make sure that we're looking at the community as a whole. So there's different areas that are kind of here, but it could sound like one or the other, but I really am talking about all of it. Walk the Talk America is actually a gun company that makes guns and ammunition and all those kinds of things. But they talk about the importance of getting your mental health in place before you buy a gun, or safe storage. There is legislation out there for safe storage that we don't have in place in Wyoming. Maybe that's something that we need to talk about. Is there a place that could, if I'm feeling like, you know, things aren't so hot right now, I need to put my gun in a safe place so that I can be safe? We don't have that person holds the gun, and then when they release it back, there's no protection, those kinds of things. So that is a whole nother piece of legislation that has not been talked about. But Walk the Talk America is very strong advocates for that. The peace in our cities, I think, is something that we would like to ask the county commission to say, yes, we are interested in becoming a member of that thing, and go. Is there the need possibly for a mental health officer? We have a county health officer, but is there the need for a mental health officer? If so, what would that look like? How would that work? Task force, which we'll talk about here in a second. The opioid fund proposals, where, how, when, and what. There's resource guides being put together. We're also looking at how can a person identify, like, is it a behavior problem? Is it my activities of daily living that's an issue? Is it a social issue? Is it an emotional issue? I don't think we always know exactly what pot we fit into, so providing a guide that will break that down for people. Kind of a cross-sector alliance to address the upstream, midstream, and downstream. Robust peer support group, braid the funding, make things an opportunity that we don't necessarily have otherwise. Shared data agreements, if there's one thing that we have been working on with the SIM project, the other word, social, I don't, anyway, SIM. The shared data agreement is like one of the biggest barriers that we have because, right, the hospital can't talk about it because of HIPAA. We can't maybe talk about it because of this, and it just is evolving. Like, we can de-identify it. We've got some starts to it, but it is a really big barrier. Making that mental health ecosystem, training businesses and faith communities, the business community wants to help. And why can't we give them strategies and tools to address their workforce as well as the public that they serve? Faith communities, working with them, Parks and Rec. These were just some potential solutions. The bolded ones are probably more of the ones that would be the more concrete ask. But when we look at the action plan, the coordinated effort for behavioral health and opioid fund allocation, or that mental health ecosystem, is to establish a task force. And I know, I get it all the time. We don't need another meeting. We don't need another task force. But this one, I would hope, has more meat, more ability to do things, make things happen, have the right players at the table. So we would investigate, implement peace in our cities, initiatives, improve access to care, explore the effective use of opioid funds, and integrate the Prosper model in our community. I broke down what those goals would be and the steps to do that. So we have to commit to it. We have to get the data, but I don't want the task force to last forever. It only will be focusing on the work that is identified, develop the strategy. Once the strategy is developed, the task force is dissolved into an implementation plan. The thing that is also brought up often is the action. We have a call to action. We've talked about it, but there's no action. We're taking pieces to build the action, but we don't have that unified movement forward. Making recommendations and financial requests. Specific work groups or strategy specific will then carry out the plan, which we already have the Homeless Coalition. Maybe that just stays as it is, but it is a piece of this overall Peace in Our Cities initiative that we would sign on to. Initiate discussions with the city and county to discuss where we can go, what can we do, because we all want that safe and thriving community. One thing that we've talked about as a barrier, for example, during COVID, I was working with the college at that time, and we needed a testing site. The college offered their firehouse. Okay, that goes way outside of like insurance and who's covered what or here, or, you know, all those red tape pieces that you have to figure out. We just made it work, and it was very successful. Jim from Central Wyoming Counseling Center has asked, we have those 2 trailers that we purchased during COVID that we utilized for vaccine and testing. What if they used that trailer to put in front of the mission to provide mental health services the same time that primary care services are provided? Okay, that's a county-owned asset, private-ish, I don't know what you really call it, your team utilizing it. Why can't we work past some of those? So it has to be the people that can make the change to do the things that are needed without worrying about the red tape or making things, you know, more complicated than they are. And I think that is what the main ask would be, is finding those key members that have the abilities and the power to work around the obstacles. We feel that it would need to be healthcare providers, municipal representatives, private sector, community organization, education, and funders. Sure, it's probably going to be a little bit larger group, but we have the teeth of the people that can make the difference with these different groups, that we work with Peace in Our City that provides the structure, and we carry things forward. So if you all have any parting remarks or anything, I think that would be the ask, is if, you know, as a county-wide, you are responsible for the county as a whole. We're not getting into city residents or Barn End residents. It's that overarching thing of what can we do and make a difference, because it's getting very frustrating. The public is frustrated because they don't hear or see what we do, because we're doing pieces of it. We're not making a gigantic impact that people can see or feel. So asking to do those kinds of things, entertain conversations about the opioid funds, improve access to care, further address the Prosper models. So any other thoughts that you all have? Left them speechless. So we're here for questions or conversation. That was the hope and the intent, that we could have conversation with you all. So I hope that you have your questions written down, and we need to talk about it, and that's really what we're here for.
So, first of all, thank you very much. I think this was productive. I didn't feel like we were going to come here today and talk for 90 minutes and walk out of here with the problem solved. I think, Anna, thank you very much. I think you've put together on fairly short notice some great ideas for us. I think, frankly, that we've got some really good ideas, and I think I have some specific questions. I think we've got till roughly 3:30 to discuss some of our questions. Dallas, do you have a question?
I do. I have to give you my mental attitude first, and I appreciate actually what you said about the churches. That struck me a little more deeply than a lot of this, but I really appreciate you all coming here and speaking to us. I think it was needed. I'm happy. I thought it was thorough. I'm certainly in favor of doing something with this opioid money. But I drifted away, and I'll tell you why. Last week, one of my best friend's boy shot himself and killed himself. A boy that I've known his whole life. And his mother's in Europe, and his sister called me, and she was in tears. I couldn't hardly understand her. Another friend of mine, this was a few years ago, his boy hung himself. And I never know what to say. I haven't called his mother back yet, because I text her, I said I will when I know what to say. I just don't know what to say. And so I know as an attorney, I've had cases where it involved suicides, and whether it was or wasn't, and what the insurance company wanted to say. And so, Sean, if you were talking to a young man, and he was thinking about killing himself, what would you say to him?
That's a really good question. I get asked that a lot. And at least in my experience with my attempt was, I just needed a social distraction, whether that was camping or hiking. That we get, oftentimes we get so wrapped up in our personal life that we don't really necessarily prioritize certain things. And oftentimes, due to the cowboy way of life out here, it's ignore and override oftentimes. That works to a point, but then whenever it's mental health, that ignore and override, it carries over on into your adult life, because then you get these not necessarily right ways to do something, but you learn these bad behaviors that oftentimes exacerbate a lot of the problems. And one thing that I've found with working with the governor's task force and being part of the Suicide Mortality Review Committee, and also looking at statistics, unfortunately, is that a lot of times with what we need is just a social distraction to get our mind off of whatever it is in order to get the courage and motivation to want to move forward.
So let me see if I can fine tune this a little better. You were me, And you'd known this boy for his whole life. What would you say to his mother? What would you actually say to her? Because I don't know what to say to her.
Are there other questions, Commissioner North?
I appreciate you all coming in this morning, or this afternoon, I guess. This morning somewhere, but not here. That's not like 5 o'clock somewhere. It's morning somewhere. You know, the suicide is a big problem. And I don't think that there's any one solution to it, because every individual is different. And every individual has different circumstances that relate to it. The only thing they have in common is how they cope with it. I don't think that's I don't think that's something that we can ever put our finger directly on as saying that that's one thing. I'm sure that every one of us up here have known people that have taken their own lives for various reasons, and trying to understand that has always been very difficult, because you'll never get the answer. It's gone. Once that happens, it's gone. And so, I do believe that our churches are a prime location for us to start working with the youth and give them opportunities to feel more at home. I also believe that part of the problem that we have in today's society is what we have sitting in front of us up here. These stupid things. You know, those and these take way too much of our time away from us, and the communication and the connection that we have with those around us. I'm not sure what the solution is or what the answer is, but I do know that people have to feel like they're part of something, and they have to be able to feel like they can go to somebody else and talk about their issues and actually be heard, not just listened to, but actually heard what they say. And if you don't do that, and we don't have that, then we've got a bigger problem. Yeah, I'm sorry, I'm old enough that I grew up in the era, pull your pants up and get on with your life, put your boots on, go down the road, and take care of it. It's not that big of a deal. Well, for some people, it is a big deal. I am not a very emotional individual. So for me, it's hard for me to understand a lot of things. Got a little better as I get older, but I do appreciate what you guys are saying. Like I said, I'm not the one to give any answers, but I do know what the base problem is. It's just a matter of figuring out how to solve that. So, but I do want to thank you guys for coming in. So, not really a question, but more of a statement.
Right. Here's a question. Thank you, commissioners. How do we reach the kids who aren't going to church, who aren't going to the Boys and Girls Club of Central Wyoming? You know, any thoughts on that?
There's a consistent data point that we always look at. If kids are involved in these activities 2+ years, juvenile delinquency behavior goes down, sexual activity goes down, the risk factors go down. So to engage those youth, we need to be very active and act with the greatest of concern for every single youth in our communities. And so we've got to make sure that we have extended hour programming happening, which is, late night teen programming, Saturday programming. And I love the ecosystem idea too, because we can kind of pull together and see where the gaps are so that we can be there for the young people. And it's going to take us to reach out and make sure that they understand what is available for those kids who are unsupervised. And families have got a grasp onto this, that if I'm not going to be there for my child, then there needs to be supervision in place. I'm starting to get on my opinion to some of this, but the data points are clear that when kids are 4-H, take YMCA, all of them, if we can get them involved and keep them involved, those risk factors go way down. And that is one thing. So how do we? I believe we have to be as dynamic as we can and create this system where we all know what each other are doing and reach them with our whole heart.
How many kids, Ashley, does the Boys and Girls Club here in, say, Natrona County touch either on a daily or weekly basis?
Yeah, on a daily basis here in Natrona County, 450 to 500 kids after school right now.
Now, my recollection, and I'm sorry that I don't know this cold, but my recollection is if a kid doesn't have an ability to get to your facility, you've got buses
We
and
do.
vans.
That's correct.
You can bring the kids, and I think transportation is obviously a barrier for kids to be involved in activities, and adults as well. I mean, we have some public transportation here in our community. It's, not that robust just because of, the size of community we are. So that's good. I personally feel two parents and church provides a lot of stability, but a lot of people don't have that luxury, and that's just a reality. And I think that whatever moves forward needs to take that into account, that is the reality for the vast majority, or at least a lot of people in today's world. Would it be helpful, in your opinions, if this commission passed a resolution on a ban or a restriction on the use of cell phones by students and teachers in the Natrona County School District?
Coach Carter from the movie Coach Carter, he says, don't fight with kids over their cell phones. Take their chargers, because you're not gonna win the battle of the cell phone. But he said he goes in schools all over the country and says, take the chargers.
Well, there are 13 states, many of them just this year, who across the country have implemented some sort of restriction or ban, and it's not necessarily implemented immediately. No phones, don't even bring them. It can be a lot less than that, but people obviously say, well, they provide assistance for the learning environment, and I'm sure they do in cases, even if you're just using your calculator. Anna?
So I would really want or recommend that we bring in the school district to that conversation. The information that I received today, there are schools that do prevent the use of them. They're in their locker or in their backpacks, and they're not allowed in the schools. And it's going to be an education for both the kids and the parents. The parents have parental rights and different things along those areas. When we were kids, you called the school office or the nurse or whatever, and that's how you got the information passed down on a hall pass or whatever the case may be. But there are some schools that are doing that now. And so I think they would be really key to have as part of the conversation, because they're not represented here. The information that I got this morning, they're doing a lot of stuff, but they're also under a lot of heat, right? So the microscope is right on them. And so like we all experience, we're doing this sliver of the puzzle, but the need is so much bigger. So I would really encourage that we would talk with them. So perhaps that would be something that the task force would look at and make recommendations utilizing the information that we get from the schools.
Well, I appreciate that, and I think you're right. So it's a trick question. No, you know, you talked about upstream, and I think that's the best way of looking at it, because at the bottom, at the downstream end is on, to my right, Coroner Whips. And so as far upstream as we can go, there's something called Section 230 immunity for social media providers, and that is nothing that's within the control of a county or a city or a town's level of jurisdiction. That doesn't mean we can't at least advocate our congressional representatives for changes, which was bipartisan at one point, for changes to some of those providers and those laws. With respect to peace in our cities, Councilor Sutherland, it would seem that the city of Casper and the city of Mills and the towns might be interested in joining this. And I know that, in fact, our city manager had you speak to some of the mayors and commissioners the other morning. Where does that conversation go, do you think?
Do you mean in terms of next steps or joining?
Yeah.
It's not too complicated. I mean, again, it's a network that's meant to be supportive. So there's no holding our county accountable if we don't meet our goals. That's not the point. It's meant to be, join so that the network can, provide access to other cities who have similar issues and have, I think, some pretty impressive plans to address their goals. And then also access to the experts who help facilitate the network. So, I mean, really the next steps, my advice would be that the county join, because it encompasses all of our municipalities, but that hopefully the municipalities are active members in learning and working with each other and working as part of this task force to help develop the plan. In addition to the county being the government body, usually the network encourages a community organization partner to also join. Anna and I have spoken about the health department potentially being an appropriate member, but also, and I haven't spoken directly with the Collective Health Trust, but I think it would, given their involvement in so many of these ongoing coalitions. And so really it's just a matter of, your body making a decision on whether you'd like to formally join. And then, I mean, I can make the connection then when I'm wearing my Peace in Our Cities hat to just essentially say, it's just the county saying we want to be part of this, and then you're in. So there's no monetary or anything. I mean, really, it really is intended to be a supportive entity helping communities meet their goals.
So it doesn't cost anything
does
for the county to join?
It does not cost anything. In fact, there are very small grant opportunities that the network has provided in the past to some of its member cities to pilot, certain initiatives that seem like they could be effective. And then, no, it's really not. It's really just meant to be, access to evidence-based information and other cities who are doing the same work.
Go ahead, Anna.
The one thing that I think, not to get lost in it, is I was talking with her about, okay, so how does that fit with our bullying, our suicide, our mental health needs, and things like that? And she talked about providing the structure that then we could plug in some of the other things, like community trauma-informed care would be something we would want to talk about across the board. ACEs is talked about a lot, adverse childhood experiences. Most people don't deal with that or talk about that. So those components would fit into this Peace in Our Cities. While it's directed or has the name violence in it or with it, it's not limited to that. It would be that overarching community response.
Yeah. For example, the city of Edmonton in Canada is one of our members, and they have a council that focuses on community wellness and safety. So it's really a comprehensive strategy to meet the safety and wellness goals for the community, which I think are really aligned with ours. And so, yeah, it doesn't, we don't have to say, oh, we're establishing an office for violence prevention. We could, but the goal is to develop a plan that meets our needs, that's context specific, that's driven by Casper. And the network and city members will be there to be supportive and responsive to those needs.
Other questions for any of our panelists? Commissioner Friel.
I apologize for coming in late. Anna, so this ecosystem is all encompassing then, correct? From children all the way to adults.
Correct. That's the public health viewpoint, is looking at the population as a whole. So it would need to encompass, from birth to end of life kinds of things.
Okay, so then my question to you have training for businesses and faith communities. What do you see the involvement of businesses being in this?
So ironically enough, one of my partners with the business council project that I was on was the CEO of the Chamber of Commerce. Talking to her about 988, hadn't heard it before, but she really became involved in understanding. We've talked about putting together a training that would give our business leaders like tools to de-escalate people, really kind of giving them the strategies. All of this stuff also, if my employee is struggling and I don't know how to intervene there, what kind of skills and tactics can I have to make a difference with my own employee? But then they also take it out to the public. So the businesses are very much key to this, right? They're in all areas, all kinds of things. You talk about the public coming in and having to deal with you don't know what kind of thing, like, are they there because they want a service? Are they there because they don't know where to ask for help? It's going to take all of the community, including industry, to really recognize that, but giving them strategy. So like the Prosper training for the suicide training that we're involved in is we would have like a standardized language that we would all share. We'd all be able to support each other, but it gets people connected to the resources that they need to have. The business owner doesn't have to have the answers. They just need to know how to connect to where to get help. Does that kind of answer the question?
It does. So it's not a monetary type thing. It's more being a part of the system itself. Do you have an idea from businesses right now as to, do you think they're supportive of it or in behind it?
For the piloting program that we're doing with DFS, for example, the Care Portal, we have business leaders that are on that team and that are serving, and philanthropists are involved. So very, very much to your question, yes.
Okay. The reason I asked that is I had a business owner come to me after some recent events with law enforcement and wanted to be involved some way, somehow. And we've now connected him with the Adam 103 Foundation, or the scholarship program, which is based off of a police officer that passed away, and there's funds sitting there, and so collectively we are now looking at a post-critical incident training that would be brought back to all law enforcement, not just one department in particular. So I bring that up because obviously there's businesses out there that are putting their funds, their time into trying to make a difference that really doesn't have a whole lot to do with them, except for the fact that you want to make sure that the people that are on the street helping you out are fit to do so. So, okay, that was my question.
Thank you. And we're about out of time. I would give you my personal thumbs up on moving forward with the task force. I don't see business representative or church representative on your proposed task force members. which is fine. That might be there at some point. It may be deemed appropriate or not, but I know you would kind of confer with our business leaders, at least on an informal basis, and with our faith leaders, and see where we can mobilize our resources to the greatest extent possible, to put together a comprehensive plan. I'm all in favor of it. Are there any individuals, are there any commissioners that, I guess, don't want the task force to move forward and have a meeting? I think you gotta have a meeting.
Mr. Chairman, not only would I support the task force, but I think we need to seriously consider moving forward with this, Councilwoman Sutherland's, peace initiative, peace in our cities, kind of help us structure that umbrella that we can fall under, and those different efforts can go under, and try to move this forward. Because I mean, we're probably all hearing it. It's like Anna said, people are out there, they hear of this or that or that or this, but they aren't seeing anything really moving forward. And it seems to be a lot of people are getting frustrated with this. And so I think between that, the task force, we can actually provide something for this community.
Mr. Chairman, I just have a brief comment, if I may.
Briefly.
Briefly. It's very brief. A few years ago, I met a man from India, and I'm going to tell you what he said when I asked him. He was a holy man from India, and he was brought into the United States by a friend of mine from India who was a lawyer. And I've been struggling with this suicide thing because I'd been running into it. I don't understand it. I don't understand it today. But he did say one thing that's always rang in my mind. And I said, well, why do you think that people take their own lives? And he says, in his own way, he says, it was very simple. He says, because they don't believe they're loved by one single person on the planet. That's what he said. And the ones that I'm aware of, I believe that was an element. Now, how do you fix that? How do you react to that? How do you deal with that? I don't know. But that's maybe you guys' job.
So, I think the Peace in Our Cities initiative is a good idea. I think that I want to confer with our legal counsel, and I would suggest I'll introduce you to Mr. Eric Nelson, whom you may be familiar with as the vice chairman of the Collective Health Trust of Natrona County. You might explore the concept of that organization being that community partner. I think they might be particularly well suited to be just that. I think we should make a formal decision on that at our October 15th meeting. And that'll give us a little bit of time to, explore any other thoughts we have, get back to you with questions. So I do appreciate the discussion. Anna, did you or your panel have anything else you want to go over? Very good. Thank you so much. We appreciate all you. Sean, thank you very much. And we appreciate what you all do in our community. So take care, and we'll be in touch. We're going to take a quick 5-minute break. All right, our next appointment is with lead appointment, Deputy County Attorney, purpose, Community Services Block Grant, CAP, board action. Good
Yes.
afternoon, and
Yes.
hi Kelly, good afternoon.
Good afternoon. When we were here during the last meeting, you all were presented with the current fiscal 2025 CSBG contract to sign or to not sign. There was a little bit of confusion on how it played out, but we have clarification now. And in order for CAP to receive the funds, one of two things needs to happen. Either the board signs off and then therefore also becomes responsible, or we've drafted a letter for you all to sign during the consent agenda if that's what you choose to do, wherein, and this came straight from the Community Services Program Manager. I think I forwarded all of the emails, but that letter then removes you all as a designated eligible entity and then makes CAP the sole delegated eligible entity for this particular grant. And if neither of those happens, then they do not receive any funds, at least with this grant.
Well, we need to avoid that. It seems like we haven't been micromanagers of this, of CAP and this program, at least to my knowledge, in the past. Now, maybe 10 or 20 years ago, maybe there was additional oversight. I don't know. I don't feel the particular need or any particular need to be, to expend our resources and time overseeing stuff that is frankly, we don't have any, I don't think any of the five of us have very much expertise in the areas. And so is there any downside, as council, our council, is there any downside to, saying we relinquish our eligible entity status for CSBG?
I do not believe so, no. We brainstormed and there was not. They have several other grants that we have nothing to do with as well.
Ms. Wessels, will you come up for just a second? And the question is, since you've spent a lot of time over the last couple of years researching kind of the background and history, if you can give us objective advice, do you see any downside for the county relinquishing the eligible entity status for CSBG?
Legal counsel is correct. We do have other grants that go directly to us. That's how your resolution provided a pathway for that several years ago. The only concern that I have at this time is that in CSBG language and referencing Heather Ross's email from the Department of Health, there was one item, the last item she wrote, is that it reclassifies us as the type of community action entity that we are. There are two under federal legislation. One is public and one is private. Her feeling is, or her opinion, is that that would change our current status. It would create a status of private. That in itself is a shift and could have other ramifications that we have not discussed yet. The board hasn't discussed it in total because it's a major lift. It could, give you an example, it could change us from being a part of even this governmental structure. Right now, I'm very thinly attached, as you well know, as an outside board. But by that grant, which defines my agency, okay, pretty much it's the core element of my funding and the core of what the agency is anchored to, changes us to a private entity in the eyes of the Community Services Division and within the CSBG legislation. I have some concerns around that only because we have not had the opportunity to plan for it, nor have we discussed it in this way. We were only dealing with the contract. When I saw that Heather had brought that forward, and that was the last line that she stated, to me that resonated very loudly, because there are different sets of rules for private community action agencies. There's a different set of organizational standards, for example, criteria that has to be met, things that I will have to put into place that, because we are currently classified as a public community action agency, I don't have. And so it does have some ramifications. It's not that it's not possible. I've worked for both. I have worked for public community action agencies, and I have worked a long time with private nonprofit community action agencies. So it's doable. It's just something that you should plan for, not do quickly.
Well, I hate unintended consequences, especially when
Me too.
they are negative. And if we are confident that there won't be negative unintended consequences for the county or for CAP, then great. But I just, CAP and the county do have a relationship, and it's quite a bit more than just the $85,000 that's a part of our annual budget. And it impacts your employees. And I don't know if those things would be impacted, but I don't want to have an oops and then have to go reinvent the wheel or go, have our legal counsel, spend a month straight on picking up the pieces. So,
May I
yeah,
say one more thing?
turn on your microphone if you would.
I'm sorry. Thank you for that. One thing I did do is this morning, I reached out to, community action agencies have a national affiliate of what's called CAP Law, and is a legal, they do all the legal interpretation for community action agencies, advisements, working through these very issues. I appreciate hearing that you believe that we have a relationship that goes beyond our financial relationship, because I think we do. I think we have a lot of opportunity to collaborate and do good things. What I would like is, because we are in a difficult position, and I appreciate everything that legal counsel has done. I appreciate the conversation that has occurred at this table. I have a contract that is not signed, and today is October 1st. That is my core funding source for the operations of the office. It is what ensures that I have staff. And so I am in a very difficult position on this. I understand exactly what the opinion is. I support it. I appreciate that the state believes that we are a good eligible entity, because we are. I just want to draw your attention to the fact that if this is the road that we're starting, that we probably should reserve some time in the next few months to have a deeper conversation about outlining our relationship more formally, so that there isn't a question. My status as a private would require me to go out and get a 501c3 almost immediately. That we do have one as a funding source. So I have what's called Friends of Cap NC that allows me to do some pass-through dollars. But it is not that is not how you would run an operation. This also, my SAMS registry, I might have to redo. There's a lot of different little things that I might need to redo, but I shouldn't do any of those until we are really clear on what our relationship is and how we want it to look for the best part of Natrona County.
And if I may, I did ask Ms. Ross specifically the October 1st question, and she stated, well, and there's a performance period clause in the contract, so they would be covered from October 1st.
For reimbursement.
Yes.
Right. I won't get front-loaded, though, which we normally get front-loaded our first month of the grant season. And I didn't get a chance to ask her that, if that would be allowable.
So, we can continue the discussion. We can take it under advisement. We can go into executive session at 5 o'clock tonight and ask any lingering questions with council, if there are any. Commissioners, do you have strong feelings about how to proceed at this point? We do have a letter in our consent agenda that's drafted that obviously takes the position that Natrona County is not going to be the signatory on the agreement. Commissioner Friel.
I would say that we take this into executive session, and I'm sure there's a couple more questions that need to be asked.
Okay. Council or Kelly, do you guys have anything else that you would like us to know or consider right now before we address this again and make a decision tonight?
I don't have anything except during executive session. Thank you.
Okay. Well, Kelly, thank you, because we know that October 1st is today and the start date. So, we understand the time sensitivity of this. Okay.
Okay, thank you.
Both. Yep.
Thank you very much for your time.
Okay, I see a couple members of the Memorial Hospital Board of Trustees here. I didn't think we had anything else on our agenda that involved that. Mr. Bell, did you, or Mr. Eiler, did either of you have something you wanted to bring to our attention? Well, I guess you did not get the memo. Originally, we did have that on our schedule, and both Banner and the Collective Trust made us aware that it was not a requirement that they attend today. We anticipate the trust being in front of us in November. So we did spend 90 minutes talking about mental health, but we really didn't talk about any status or developments. And so I apologize for us not letting you guys know, because it obviously didn't get knocked off your schedules. But we obviously don't have the collective or banner here today to give us any information, updates, or reports. Sorry, gentlemen, I didn't want you to just sit here and, okay, very good. Thank you. The next item we have is Teton County Board of County Commissioners versus State in the pending Supreme Court case S-24-175 as just an update. Heather, do you want to start or do you want me to start? Oh. Commissioners, have you seen the letter that I sent to the Wyoming community, the Wyoming County Commissioners Association requesting they, I guess, act or involve itself as a amicus party in that case? Did you guys see my letter? One of the things you'll recall us discussing and determining before I sent that letter was that we would make effort to hire legal counsel to explore and represent us as an amicus party in that same pending suit. Ultimately, we didn't have to do that, which is very good from a fiscal perspective. I think that the County Commissioners Association worked very efficiently in retaining counsel and in filing briefs. I would say that this morning, the County Commissioners Association's motion for leave to file amicus curiae brief in that case was granted by the Wyoming Supreme Court. The Wyoming Supreme Court could have declined. The Wyoming Supreme Court could have said, you guys don't need to be involved or have any briefing or any participation in the oral arguments. So our brief is part of the record. Arguments will be considered by the Wyoming Supreme Court that were made. I think that the brief that was filed was strong. An opinion won't come out from the Wyoming Supreme Court in my experience for probably a year. But I would hope this commission will agree to participate financially in the cost of litigation. Teton County is participating either $10,000, I think it's $10,000 is what one of their commissioners told me last week. I would like to see us participate to the level of $5,000. I think we were prepared to invest far more than that. If we were to have hired our own attorney, I think it, in my experience, would have cost $30,000 or potentially more. So I'd like to see this commission tonight approve the funding of $5,000 to the Wyoming County Commissioners Association for to help defray litigation costs. Any comments or feedback on that?
Sorry, what was the total cost on that?
Well, we don't have.
Oh,
We don't have the total cost yet. Because the total cost will it probably involve additional work by the attorney, so we don't have a bill yet. And we won't be getting the bill. Wyoming County Commissioners Association doesn't have a bill yet.
So that'd have to be added onto the agenda, correct?
Yes.
Okay. I don't have a problem adding that if nobody else wants to.
Do we want to just add that to the consent? Or do we have to add that separately?
Well, if it's going to be on the consent agenda, don't we need something in writing? Like a Dear Wyoming County Commission Association enclosed is our check to help defray the costs. I don't know exactly how we ought to do that.
Well, Mr. Chairman, I think the consent agenda could just be amended to add the commission's approval of
Okay.
payment of that, and then we can follow up with a transmittal letter with the payment to the.
And then we
county
just vote
commissioners.
on it unless somebody wants to pull it.
Yes, sir.
Should we know what the real bill's gonna be at the end, though? We might want to pay more than 5 or less than 5 or whatever. I mean, I don't know what the bill's gonna be.
I don't either. I think that this is a good faith move on our part. And I think that I'm not sure how the WCCA is going to be billed. I'm not a party to, nor is Natrona County a party to the engagement agreement with the attorneys. I think that it's just simple to send a check to WCCA for the litigation costs, and if we learn later that, you know, that the bill is far in excess of what anybody was thinking, then we can revisit the issue. But I know that the Wyoming County Commissioners Association is prepared to pay for the entire bill, but I am certain that it's going to be $15,000 or more. And so that's why if we send in $5,000, I think that it's a good faith move on our part. Commissioner Friel.
I agree with you, Mr. Chair. I think we should send it in.
Commissioner North.
I agree. Also, and I do want to, after reading through that amicus brief, they did a very thorough job. They did a really good job on that, in my opinion. Not being a lawyer, but I have read plenty of legal stuff, and they did cover it pretty well.
Did you like my letter too?
Yeah, well, you know, that was all right.
You quit fishing
I thought it was a good letter. Anyway, okay, well, we will add that to the consent agenda. If Michelle can get it on there, great. If not, we'll have one of the commissioners, we'll have Commissioner Milne make the motion to add it. Heather, did you have anything else on that?
The only other thing is that the state of Wyoming, the Board of Land Commissioners, their brief is due October 14th. So
Okay.
about 2 weeks here. I'll send it to you when it's filed on the public docket.
Great. Okay, well, it was also the subject of conversation down at the WCCA Waco session last week. I had discussion with 3 of the statewide elected officials, and a 4th mentioned Natrona County in his remarks. I think this is certainly a very visible issue, and that issue being local control of land use. So anyway, we will see where it goes from here. All right, Heather, for your next for agenda review and legal update.
I can try to address any questions for the agenda. I will note that I'm not the one with the most information on any of the items, so if you have any questions, I'll text my friends and get information. But we have 4 planning and zoning items, and then just the consent agenda items. Are there any questions?
Heather, I did have one on the planning and zoning.
Sure.
If I can find it real quick, apologize. Yeah, it was, zone change 24-02. We're not creating a spot zone necessarily. We're just kind of extending one, or how is that working there with that chunk going?
2402, so this is the HEED application.
Right. I mean, the stuff to the west of it that is highlighted, and then on our maps, and then we have stuff that's in picture. Is that at that point, the stuff that's in the satellite picture, is that city at that point?
I believe it is, yes.
And then, and so we're not really quite creating a spot zone for on that east side of it, or how? I'm just kind of, I'm not sure if the lines are accurate where you're running them, or if there's just these tiny little strips of UA that is keeping it from being a spot zone. That's so hodgepodged up there anyways. It's just ridiculous.
It does appear to be a mix of a lot of different things. So yeah, I do think these are probably the best questions for, it'll be Jared actually that's reporting tonight. Mr. Gustafson's not available. So I know that I'm sure that they evaluated the application and the parcels to,
Right.
with respect to trying to make sure that we weren't going down that path with respect to a spot zone.
Yeah, no, I'm sure. I just kind of giving somebody a heads up for a question later tonight.
Okay,
so
very
you can
good.
Figure it out.
Jim, it is associated. I mean, it's not, it wouldn't be a spot. It's right next to it. So I remember them talking about that previous. It's just an extension. It wouldn't be a spot. It's just an extension right next to it.
Right. What I'm saying though is the there's like just this finger strip to the south of it. Is that what they're using to say that there's not a spot zone then created by with a UC or UA to the west of it? You're looking at the wrong one, Dave. Right there. Is that creating this here? Yeah, yeah, that little itty bitty finger strip. Oh,
I know these people, so I'm staying out of this, but I think that's getting.
all taken care of.
Are you talking about the one that's on?
ZC 24, it's over on Bryan Stock.
Yeah, that's not there. It is tied in. I've looked at all those maps. That was covered pretty extensively in the plan and zoning. So it's not a spot.
It's almost a spot,
Almost a spot, but it's not a spot
although we have a spot north of it.
because they have stuff north.
All right.
And I guess I'll just point out what I noticed with the 2022 zoning resolution is that it appears that the requirements for a zone change are significantly less than they used to be under the 2000 zoning resolution. So you have a lot more latitude, it appears, to me anyway.
Okay. On the consent agenda, we have the MOU concerning Metro Animal Shelter. I know we've all had a chance to look at that. I did look at it, and I think that we've tightened that up and made some clarifications. I appreciate council's and the city's efforts in putting that together. Though there was just a question in my mind And this is page 15 in our packet. Medical treatment. Kind of throughout the document, it says Natrona County animal, a Natrona County animal. Well, that we know what that is, right? But then in subsections B and C, we don't have the limitation or it's not explicit that when it says all vet services will be billed directly to Natrona County, I think we infer that it means for Natrona County animals, but it doesn't say that. It says that in almost every other paragraph. And then in C, this is 5C and 5B. Natrona County shall defer to Metro for coordination with vet service of Metro's choosing. Fine. Natrona County is responsible for all veterinary bills, period. I would have thought that it would say Natrona County is responsible for all veterinary bills for Natrona County animals. So my preference would be that we put Natrona County animals in both those two subsections that would, in my mind, or then it would be, in my mind, consistent with the intent of the entire agreement. If council and the commissioners feel we should just move forward, then we can do that. And I don't mean to be trivial about this, but, and I know that the city wouldn't send us a bill for all veterinary bills, period. But I think it's just kind of a drafting, you know, in the private realm, we would have that clarified. Commissioner Friel?
Is there a way that we can clarify that change in there and still get it signed tonight?
I would hope so, and if you guys approve it with those two Natrona County animal, I'll write them in, and then initial it, and then sign it, because I want this done tonight. Trust me. I don't want to say, well, here are 2 reasons to kick it another 2 weeks down. We should not do that.
That's the only reason I ask is they've been needing to get this signed and we're working without an agreement again.
And
on
please,
another thing,
yes,
so-
do not interpret this as a stall tactic. It is
No,
not.
no,
It's just
for
like,
sure.
ideally it would have that in there.
I want it to be proper and written proper, but if we could fix that and then sign off on it tonight, I'd prefer that too.
Mr. Chairman, I agree with Commissioner Friel that we do need to get it done, but I also agree with you that this needs to be done properly with that language put in there. Just experience through the joint powers for the jail and the Hall of Justice, that stuff needs to be enshrined into the document, not just a tribal knowledge thing.
Heather, can you work on that or have, is Lita the one?
Lead is the one that has done the majority of the work for that. So you'll approve it contingent upon those additions, is that?
Yeah,
Okay.
yeah,
All right.
yeah. I think we just stick in Natrona County animals in the appropriate places in each of those 2 subparagraphs, 5B and 5C, and we're good. All right, anything else for council?
I have a question.
Yeah, Dallas.
Heather, do we need to have a document that is signed by the chairman referencing the removal of the mining issue in the last meeting?
Yes, there should be a resolution that'll come forward for the chairman's approval, and then it'll be recorded.
When will that be done?
It should be soon, if it's not done already.
Well, would you be able to find out in your office if it's done already? We can sign it and get it done with?
Well, yeah, you can speak with Jared, who has been.
I don't think there's any reason to stall this. I think we should sign it and get it in.
Right.
So are we able to do that today?
Perhaps if it's done, if the resolution is done. I don't know. It may be already complete and signed. I haven't seen it, but we can find out.
I'm sure you can.
Thank you, Michelle, for giving us a revised consent agenda showing item 3F. Heather, did you have a chance to see that? do we need to say anything in addition to that?
Well, I would recommend that we just, that it say that it's approval of the commissioners paying $5,000 to the County Commissioners Association. Just that it's a little more clear what we're approving, I guess, for the amicus brief.
Okay, I've got that, Jim, if you want. Okay.
Right along with that. So Heather, we just need to do we need to bring that off of it and then add that in, that verbiage in there?
Well, if Michelle, who is working on 50 things right now, has a minute to, all right, you got to jump. Thank you, Michelle. And the room looks great. You're moving these tables like a champ. Fist bump. Okay.
Sorry, I only got one good eye and the good eye messed up.
At least we're not getting the evil eye. Maybe we deserve it though. Okay. Any other questions? Commissioner Roundtable. Commissioner Frew, would you like to go first?
I really don't have anything today.
Commissioner, Mill.
Actually, I'd like to give up my time. I'd like to hear about the meeting down in Rock Springs.
Okay.
Anything important or anything that came up?
Okay. Commissioner North and I can hopefully tag team on that, but let's you and I go last, and then.
I don't have anything.
Okay, Commissioner North, I think between us, we attended a lot of it.
Pretty much everything.
So why don't you give it the first stab and I'll fill in.
Okay. We had a really good speaker down there that was very inspirational. That's one wounded warrior that had a severe brain injury, and he's recovered for the most part. You know, some of that stuff you never recover 100%, but that was a very inspirational speech that he gave. We did have we had a tour that was out at one of the Natrona mines, and Commissioner Nick Layson and I got to go 850 feet underground and run around in the cool over there, and that was definitely an experience that it was enjoyable, but I don't want to work down there. So the mine we went to has 2,200 miles of tunnels underground out there, and they've been in business since '62. So that was something that was interesting. We also talked about our congressional tour that's going to be coming up, that Natrona County and Sweetwater and Fremont County and Carbon County are going to be in charge of next year. We need to kind of start figuring out just exactly where we want to show these people, because a lot of them, this may be the first time they're ever out here in the West. So we want to expose them to things that are truly our concerns. One of the things that was brought up is our water issues, so they understand, you know, that's one thing that we all four of the counties have in common, is our canal systems are old. They need upgrading, and honestly speaking, we're going to need federal funding for a lot of that stuff, and so that's something that we need to really look at. I'm trying to think of what else we covered. There was a lot that was covered down there. We did vote to make cheatgrass a invasive species in Wyoming on the state level. It already is in Natrona County. It already is in a lot of different counties, but that's something that we did talk about, and it was kind of a split decision. If I remember right, the overall vote ended up being 10 to 6 or something like that. I can't remember exactly what it was, but there was the biggest concern about that was if the counties were going to have to spend money directly, if they were going to have to put that as their top priority because it was listed. And and those are reasonable concerns, but there's a lot of noxious weeds that we have in the county that they don't necessarily put all their focus on that. The counties still have that authority to work on that. But I think that's one of the biggest things that we need to look at. Obviously, the fires were brought up. The state has pretty much depleted its resources this year with all the fires we had in the Northeast and Togety Pass as well. So that's something that is going to affect us, and that's something that we probably need to look at in the future, if nothing else from a legislative level, to put a little bit more money in that, because if it's there and it's available, then that helps us out. I'll let you finish up. Hopefully I got a good chunk.
Yep, that's great. So the individual Commissioner North was referring to that was a really impactful speaker was Sergeant Amos Benjamin, and super powerful story. I mean, if you ever think things look pretty bad for you, he's an example of when you lose your brother over in Afghanistan, when you lose your father to suicide, when you have lots of mental health issues, substance abuse, and he talked about sitting in a deer blind down in Texas, kind of a Wounded Warriors. I'm not sure if it was exactly that program, but kind of that thing, and having a faith moment where he said God spoke to him, and then everything else, he accepted the nudge, and it really turned his life around. And now, I mean, this guy is a polished speaker for being, well, he's probably 28 or I can't remember, but he is, it might be 30. No, so super impressive. And again, Amos Benjamin, and you might look him up and read about his story. Quite an inspiration. This mine tour, it was like going down to another world. It was really amazing to see these, like Commissioner North said, we were down at 850 feet, but super impressive organization, Sisagem, I think is how you say it. It looks like Sisacam, but in any event, it's a really well-run outfit, and we couldn't take any photos. They would not even let you take your phone down there. In fact, they wouldn't let us take it up walking around either, primarily for safety, but I think also some trade secret confidentiality stuff, concerns, that there are four other companies, I think, and one coming online. In any event, super interesting, and then that kind of dovetails with this congressional tour. If you've been to WCCA meetings, you've heard this before, but this is where a group of counties, kind of regionally based, puts on this tour, and for staffers of senators and representatives, primarily from DC, help them understand what Wyoming's all about, and it's been paying dividends already. So, Commissioner North, did you have any sidebar conversations that would indicate who's going to be the lead county? I know that Micah was encouraging us to figure that out pretty quick.
No.
From
we talked about it, but nobody really stepped up. At this point in time, it was like, okay, let's figure it out.
Yeah, from a staffing capacity issue, I don't think Natrona County has the capacity to be the lead county. There is quite a bit involved. We know that there could be a lot of miles traveled. They have to cram this all in 3 days.
I can't remember, I think it was longer than that.
Okay, well,
But it's,
maybe it's
last year,
4 or
they,
5 days
last year
plus
they
travel.
had problems because their plane got canceled. And so they had staggered groups of people coming in.
Mhm.
And so they didn't get quite the full bore load until the very end. But one thing we did talk about doing is having them fly in to Natrona County, make the circle cross through Fremont County, going across South Pass into Sweetwater County, coming back through Carbon County, and then ending up back in Natrona County to fly back out again. So that was one thing that we kind of did discuss, and I think everybody thought that was a good game plan.
Yeah, the other would be flying in or out of Rock Springs for one, and in or out of Casper for the other. So commissioners, let's just do some brainstorming just off the top of our heads. What in Natrona County, what do we have that is, that you would want people that have never been to Wyoming and may never be back to Wyoming, what would you want them to see in Natrona County?
As far as it's a good question, but right now, I would like to have them see the Kendrick Canal system and going all the way up to Pathfinder and seeing how that whole area has been developed. I think that's something that's important because we can show them how old some of that canal system is and how much it needs to be worked on at this point in time. That's one thing. The other thing we could look at too is on the way over to Fremont County is you got Black Hills Bentonite out off 33 Mile Road to show them some of the open mining operations and things like that. I really think that them being exposed to just how open this part of the world is. And one of the things they recommend doing is that on the bus tours going across, that you have 2 or 3 different speakers on those buses with them. So you're presenting the whole time. So you've got a captive audience the entire time they're on the bus traveling, because that's when we're going to have them for the most part is that's when we're going to be able to talk about things and talk about different things. We've got some of the deepest wells in the country out here in Lysite and some of those areas. We have some different areas that we can look at, but
you can't really,
you can't see it all.
What a 20,000 foot well.
Yeah.
Well, you and I had talked about the Kendrick project, which goes back to the 1930s through an act of Congress, and we all know what that irrigation district has done, and they may or may not have done that. Fremont County has a big one, and then Goshen County has a big one. But I think that they definitely would ought to see Pathfinder, Alcova Gray Reef, and it kind of, we can talk about Marton Ranch, we can talk about the, what was the other ranch? Johnson, over by the bypass road. That was one that involved the Conservation Trust. We ought to talk about Midwest Edgerton. It was the Naval Petroleum Strategic Reserve. Then, we still can talk about, even though we've got, very small communities up there, how much that contributes to, and has contributed to, our, I think the whole country. So I think that's, not really on the way, Midwest Edgerton. But I think that would be one that if we can fit it in would be a good idea too.
Might be able to fit it in with your conversation for smaller towns. If you're heading from Casper to Fremont, take that back road up around past Lost Cabin and whatnot. You'll be able to see the plants. You'll be able to talk about the deep wells, be able to talk about grazing rights and multi-use of BLM. They can see the road structure on the backways and all that. So
Well, remember, they're gonna be in a bus. So,
that road's fine enough for a
yeah,
bus.
well, you're right, it is. I mean, that's a good road going the back way to Lyside, so.
The other thing, and I'm going to talk about this in my, at some point, either now or either roundtable or commissioner comments. I'll probably just wait. But we have a remarkable airport now. After December 3rd, Delta won't be there unless they come back. But I mean, but if you look at the firefighting that is there and that is going to be there and that is we're trying to get large and very large tankers, the numbers are really pretty incredible with the number of flights or missions and retardants. So I'll give you numbers tonight in commissioner comments. Also, you know, we're trying to get a new airport control tower, and this commission has, you know, has agreed to fund $2 million of this project, and that would be a big deal for us. Our customs, you know, Dale Latham, by the way, that's October 18th, Friday, October 18th, if you can make that ceremony, that is renaming the customs area for him, that would be good. But that customs thing is a huge deal for us, and we have the Scottsdale Mint, and you know, it's that kind of thing with free trade zones. You know, it's we've had effective congressional representatives, and we've had an effective airport manager, and we've had, you know, others that have really been, you know, great landing some of these big contributors to our current and future economy and community.
Don't forget basically it's turning into a regional training for the firefighters.
Yeah, and we got, yes, it's busier than ever, and that's wonderful too. Okay, well, I think that's some good
I do have a
brainstorming.
question, sir.
Sir,
Dave or Dallas, the emergency boiler thing, what was that all about up at the jail?
The emergency boiler.
Yeah, there was a boiler issue up at the jail that Hades came in.
They fixed one of them.
Yeah,
They said that we approved it to have them all fixed. Of course, he says he can get the equipment, the boilers are in place, all of that kind of thing. Said the way he explained everything to us, it's under control now. There are things that are wearing out. He's crossing his fingers about, and that's the problem. Next door, the
Yeah,
bathrooms down there.
It's actually at the
Nobody
Hall of
wants to-
Justice.
Hall of Justice,
Yeah, it was
okay.
upstairs in the Hall of Justice. They've got redundancy right now, but we're gonna need to put that on
Nobody wants to
on the-
work down there is the problem.
so.
Okay.
Yeah, no, it was actually at the Hall of
Hall of
Justice. That's
Justice.
why I was like, because we've replaced and fixed everything up at the detention center as far as the boilers that. we
Right,
had
and
to-
that's why.
Yeah,
my
there
point
was,
on me there.
yeah, they're gonna put a vent system in one of those to cool it off a little bit. But other than that, that was about it, just because it gets miserable in there during the summertime. But Garrett did talk about one of the boilers over here, that one of the pumps it's still working, but
So we still have one at least going.
but we don't know. Yeah, but we have a backup redundancy, and that one's working all right. So that's something that we were looking at putting on our budget for next year. And so we can get that taken care of along with the city as joint powers board.
We do have certain issues that we discussed, and just bear in mind, the city's gonna probably be out of that building in around 2 years, so we're gonna lose that 40% that we get from them. And, there are problems. And one thing that did come up is Garrett said to relight this with the newfangled lighting would be $5,400. So I've been told that the savings to us would pay for the cost of putting that in, the lighting. Huh?
You got a new lamp, right?
I know. So I'm just telling you what he said. But it's something to consider. We may want to test it out, see what it looks like, especially if the power company gives us a deal. And whatever they say, it may save us in this overall building in terms of power. Might pay for a lot of it to be done. So I don't know that to be sure, but he's looking into it.
All right, thank you.
The only other thing I wanted to mention, and I was looking for some photos of one of the slides that was presented at WCCA. There was the administrator of the industrial siding division spoke, and it was really informative in terms of hearing how the impact assistant payments are calculated and then awarded, and what happens in the event that there's a shortfall. Someone can petition to go back to the Industrial Siding Council and ask for additional funding. What was most interesting to me is that the administrator has 2 open staff positions and she can't fill them, and she has something like 20 wind farms coming up in the next 12 to 15 months, 7 solar, 2 or 3 carbon capture, 5 carbon capture. Because then she tells us what the status of each of them is, but it's really mind-blowing that one person would be tasked with trying to juggle all of it. And what was particularly interesting to me is I dealt with these matters as an attorney in private practice, and represented parties in Industrial Siding Council permit matters in 2009 and 2011 and 2014, and they only had 3 staff members then. So this is one of those things where government needs to get bigger, all right? And by that I mean that department needs help, and that department, I think, needs to add another employee, and then they need to fill those 2 positions. But even if they were filled, it would be woefully inadequate for them to do a good job, and their job includes reviewing and making recommendations and doing all the due diligence for the council to make its decision. And there's a crazy amount involved in that. And there's a really short statutory trigger or time frame, and you've seen their notices where we have to, it's basically 90 days and it goes to hearing. And so, if one of the things I'm going to talk to legislators and the governor about is providing additional support for that, because it's like 6 times the amount of current work they have is in the pipeline. So it's really going to hit them hard. And if they're not doing a good job, all of our state's going to suffer. So I'll get off my soapbox. But I'm saying that if you have conversations, with others, you can kind of give them an earful. Thank you. I'm not seeing anything else. Anybody else have a whole lot? Okay, great. We're adjourned.